All right. Good morning, everyone. We are here today with our Health Commissioner, Dr. Jaraza, our Police Commissioner, Michael Harrison. We are here to give a COVID update for Baltimore City. We're also joined by Kendra Summons, one of our value ambassadors for the Latinx community. Kendra is one of the people doing the tough but necessary work of reaching our most vulnerable residents and doing so in a culturally competent way. As we have throughout this pandemic, the Health Commissioner and I will remain focused on ensuring Baltimore's distribution of vaccine is equitable. My administration will continue to target our efforts to reach those who have not been able to yet access a vaccine. Today, we're excited to celebrate a major milestone with everyone here. City of Baltimore has hit and held its 200th mobile vaccination clinic. Pop-up and mobile efforts will continue in a big way across our city moving forward. Importantly, they will be driven by the data about who we need to reach. That means we will go where the vaccine rates are the lowest. The next phase of our vaccination rate as a city will be focused on those zip codes, neighborhoods, and communities so that we can reach the people that we know need to have the vaccine. We saw how critically important the availability of mass vaccination sites were during the early days of vaccine ability, and I'm proud as of today, more than 55% of Baltimore's adult population has gotten at least one dose of the vaccine. We are making steady progress toward our goal of 65% of the adult vaccination before the Health Commissioner lifts the mask requirement for indoor spaces when not eating or drinking and outdoor ticketed events. Now, we have to double down and accelerate our efforts to reach our homebound populations, our residents with limited access to transportation, and others, including our working families. We know that the CDC has issued guidance around the benefits that come with vaccination, including being able to remove your mask when outdoors. We continue to encourage all residents to take steps to mitigate the risk of COVID-19 spread when in large groups and indoors. I want to remind everyone that you can follow along with the key vaccination metrics and see our progress as a city by viewing our dashboard at covax.baltimorecity.gov. The information is updated daily. I would like to now turn it over to Dr. Jaraza for further update on where we stand with COVID in Baltimore. Thank you.
Good morning, and thank you, Mayor Scott, for your continued and steady leadership. To review our latest case data, we continue to see marked improvements in COVID-19 metrics. As of yesterday evening, our daily new case count was approximately 26 new cases per day, a decrease of 84% from 4 weeks ago. To date, there have been a total of 52,852 confirmed cases in Baltimore City. 1,079 Baltimore City residents have lost their lives to COVID, and we are now averaging close to 2 deaths per day. Our current positivity is 1.1%, a 66% decrease from 4 weeks ago. Our intensive care units and acute care unit capacity have decreased and are both holding at 82% and 87% respectively. As of today, as Mayor Scott mentioned, 55% of adults 18 and older have been vaccinated with either a first or a single dose, while 45% of adults in the city are fully vaccinated. As a reminder, Baltimore City will be maintaining an indoor mask mandate until at least 65% of adults 18 and over have received their first or single vaccine. This is consistent with the state of Maryland's statewide vaccination rates when they lifted their indoor mask mandate. As was reported yesterday, the mass vaccination site at M&T Bank will be closing in early July. Today, I'm also announcing the closure of Baltimore City Health Department's mass vaccination site at BCCC, which performed its last second dose clinic on Wednesday, June 2nd. I'd like to take this opportunity to acknowledge the work of our staff members and partners, including Baltimore City Community College, Under Armour, all of the local schools of nursing and pharmacy who provided vaccinators, many other Baltimore City agencies, including Rec and Parks, fire, police, and so many others. I'd also like to thank the over 100 Maryland Responds Medical Reserve Corps volunteer from all over Maryland who pitched in to support the effort, serving as vaccinators, registration staff, and providing medical consultation. Together, we were able to distribute nearly 25,000 doses of Moderna and Johnson & Johnson vaccines to individuals living and working in Baltimore City at BCCC. The winding down of operations at our mass vaccination site was expected to come during the summer, a factor that we took into account as we developed our overall COVID-19 vaccination strategy. Mass vaccination sites have played a crucial role in vaccinating early priority groups and those with the time and the means to travel to a site. But we've always known that the summer would be focused on mobile and pop-up clinics. Closing the health department's mass vaccination site allows us to redirect staff and resources to support an increase in the number of mobile and pop-up vaccination clinics that we can host throughout the city. We know that there are residents who may not want the vaccines now, but for many reasons, they were unable to visit a mass vaccination site. There are also some residents who didn't want to be the first ones to get vaccinated and took a wait-and-see approach before seeking an appointment. Our teams will continue to work with clinical and community partners, utilizing zip code level vaccination data to set up our mobile and pop-up clinics in areas of the city with lowest vaccination coverage, ensuring the equitable distribution of the vaccines. We will be setting up semi-permanent vaccination sites in the same location for a few weeks at a time to ensure that local residents are aware of community opportunities for vaccination. We will also be partnering with other events and other departments to offer vaccines in untraditional locations such as farmers markets, resource fairs, and other community events over the course of the summer. For more information on current vaccination sites, go to coronavirus.baltimorecity.gov and click on the weekly schedule of COVID vaccination clinics. I'm grateful to each one of you who has already been vaccinated, and the role that you have played in saving lives by reducing the chances of disease transmission between you and your friends and your family cannot be overstated. However, reaching our 65% benchmark to lift the indoor mask mandate, as well as longer-term goal of 80% of all residents being vaccinated by early 2022, means that we need to acknowledge the difference between earlier vaccination efforts and where we are today. The pop-up and mobile sites planned for the summer will see our success measured in the hundreds and thousands per week, and less so in the 10,000s. But it remains absolutely vital that we get a clear majority of our residents vaccinated. The overall decrease in new cases, hospitalizations, and fatalities are directly related to our increased rate of vaccinations, and this will continue to fall as more and more people receive their vaccine. But we also know there are more transmissible variants, and we're keenly aware of the possibility of a fall or winter surge of coronavirus cases if we don't reach a majority of the city's residents with vaccines. This summer is the time to get vaccinated. Vaccines remain free of charge, and no identification is required to receive your free vaccine. The health department has released weekly online schedules of our mobile and pop-up clinics. These sites do require pre-registration, and residents can pre-register at covax.baltimorecity.gov or call 443-984-8650 to make an appointment. If you need help with transportation to any vaccination site, please call 410-372-3444 or email covidtransport@mjminnovations.com. For city residents who are homebound, the health department continues working with the Baltimore City Fire Department and a growing number of clinical partners to provide vaccination to you and your caregiver in your home. If you're homebound, you should register at the same site, covax.baltimorecity.gov. If you don't have internet access, you can also call our Maryland Access Point at 410-396-2273, Monday through Friday, 8:30 a.m. to 4:30 p.m., and our staff will help you register. We're still accepting applications from interested community organizations and individuals who want to assist in our work in canvassing and setting up community vaccination sites with grants of up to $5,000. Those interested can visit civicworks.com/COVAX small grants for more information. Even as we create more access points for unvaccinated residents, we acknowledge that many continue to deliberate on whether getting a vaccine is the right choice for them and their families. I want to acknowledge that while choosing to get yourself and your family vaccinated is a personal decision, it has implications on your surrounding community, making it vitally important not just for your well-being, but also for the health and well-being of those around you. We know that as a government entity, you may not always trust what we say. For this reason, we have partnered with community members who've been vaccinated to share information and resources on the vaccine itself and how and where to get vaccinated. Our value community team members are canvassing daily, ensuring that residents are talking to peers that can answer and address specific concerns about the vaccines. We also encourage residents who may still be on the fence about getting the vaccine to check in with your friends and family members who've been vaccinated and ask them about their experience. We all want to return to normalcy. We all want to have a summer filled with fun activities, and we all want our children to remain safely in school next fall. Getting vaccinated is a clear step to ensuring this can happen. Now more than ever, we can win the fight against COVID. Now more than ever, vaccines are widely available, and we know that they're safe and effective. Baltimore, we're counting on you to get vaccinated now so that we can return to pre-pandemic normalcy. It's Baltimore versus COVID, and we will win this together. I now have the pleasure of introducing one of our value ambassadors for the Latinx group, Ms. Kendra Summers.
Hello, thank you for the opportunity to talk about the work of our value ambassadors and the efforts that we're taking to ensure that all of our residents are able to receive the vaccine and to also have the opportunity for their specific questions to be answered, for their concerns addressed, and most importantly, to remove as many barriers as possible, ensuring equitable access to the vaccine. My name is Kendra Summers. I am a value ambassador with the Latinx Ambassador Group. Over the past few weeks, my team has worked extensively with our Latinx population, canvassing and knocking on doors to let our community know about local vaccination events happening near them, as well as talking directly to families who may have questions or concerns about the vaccine. The value program was set up because we know that there is not a one-size-fits-all solution to addressing the vaccine deliberation, and studies have shown for years that questions people have about vaccines are as diverse as the communities that make up our city. In order to provide the right information to residents, the Baltimore City Health Department's value communities held numerous community conversations about the vaccine. While some themes are common across all value communities, this research has helped to provide insight as to which concerns were top of mind in some communities, which have helped us in our outreach efforts. My team speaks to our Latinx residents, uplifting the shared benefits of the vaccine by reminding residents that getting the COVID shot protects not only you, but your loved ones too. We also remind residents that if you live in a home with multiple people and work in a place where it is difficult to stay socially distanced, it is vital to get vaccinated. We also remind residents that children can transmit COVID-19 and that a vaccine is now available for those 12 and older. We know that insurance and identification are concerns for many, and our teams remind people that the COVID vaccinations are totally free and there is no insurance or documentation required to get a vaccine. Some sites may ask you for a form of identification, but you can get a vaccine even if you don't have an ID. For residents that speak Spanish, we provide information about the Esperanza Center, who can help get residents connected to a vaccination site that meets their needs. Something that we've learned through focus grouping is the need to address questions around side effects, and more specifically, the potential need to take off of work because of those side effects. We tell our Latinx communities that although you may need to take a small amount of time off of work to get a COVID vaccine, getting infected with COVID-19 may mean you can't work at all. COVID-19 is serious and can cause long-lasting effects that prevent you from working or providing for your family. Most importantly, a COVID-19 vaccine can help you stay safe at work. We encourage residents to talk to their coworkers and employers. We know it takes time to get a vaccine and that everyone does react differently, but some people do need to take off of work. Some are fine with just painkillers. Some don't need anything at all. It is true, you may feel bad for a day or two after being vaccinated, but if you get COVID-19, symptoms and outcomes could be much worse. Our direct outreach efforts are clearly showing an impact. Just this morning, our online vaccination dashboard shows that the first and single dose vaccination rate of those who identify as Hispanic is 43.2%, which has actually surpassed the percentage of non-Hispanic city residents at 42.3%. This information gives us the confidence to continue moving forward with outreach, and with time, will ensure equitable distribution of vaccines across our many communities. Our Latinx community group is just one of many Baltimore City Health Department's Value Community Ambassador programs. Overall, the Health Department's Value Ambassadors are addressing vaccine deliberation in key Baltimore City constituencies, including African Americans, older adults, individuals experiencing homelessness, Orthodox Jewish community members, young men, pregnant and lactating women, immigrants, pediatric populations, communities of faith, and people with disabilities. We know that this work is important, and we are working daily to ensure that all of our residents have their voices heard and are able to access the vaccine. Thank you.
Thank you, Kendra, and thank you for the great and important work that you guys have been doing each and every day in our communities. And one of the best things that you can do if you've already been vaccinated is to take the time this weekend and every day to check in with your families and friends who have questions or may not know, or help them out with an appointment. Remember, you can visit covax.baltimorecity.gov. Again, that's covax.baltimorecity.gov to get connected with an available appointment, or call 443-984-8650. That's 443-984-8650. The health department also now has a transportation service to help you to and from your vaccine clinic. If you need help with vaccine transportation, please call 410-372-3444. That's 410-372-3444. And before we close, I also want to take a moment to for us to acknowledge that today is National Gun Violence Awareness Day, and understand where we need to and where we're trying to go in Baltimore to fight this disease of gun violence. And the match today, of course, was we can end gun violence, we can cure gun violence in Baltimore, not just with the women and men of the police department, but the great folks at Safe Streets, every single city agency, but more importantly, every single city resident, understanding that we all have a responsibility to help us cure this disease in our city. And thank you. We'll take some questions. Emily? I can hear them. I can hear you, Cal.
I was just going to say, it's hot as the Dickens out here, and we don't have
There you go.
fans. So can we limit it to 2 questions per outlet? Thanks.
Maxine? No?
Hello, good morning.
Hello, Kate. How are you?
I'm good, how are you?
I'm all right.
So, I just did some quick math using census data in your dashboard, and last week you were at 55% of adults who had at least
We're
one.
at 54%. 54
A
last
week
week.
later, you're at 55%. Are you satisfied with the pace that it's about 4,500 or so a week? Are you happy with this pace? And what do you say to people who might do the math and realize at this pace it'll take us to mid-August to lift the mask mandate?
Yeah, I think that first, we're happy that people are getting vaccinated. We want more folks to get vaccinated. I think that's clear. And that's why we're continuing to ask folks to talk to everyone that they know, everyone in their family, everyone that in their friend group, to advise them to get vaccinated. Again, that's the importance of the work that we're doing with our mobile clinics. I think, Kate, you know very well the transportation issues that neighborhoods have in Baltimore. Imagine if you lived in Curtis Bay, how hard it would be for you to get from Curtis Bay to anywhere in Baltimore to get a vaccine. Or if you lived in Park Heights, where I grew up. That's why we are taking, or Emerson Village, where we had a mobile clinic last week. This is why we're taking the vaccine to those communities, working with people so that we're eliminating every excuse to allow people to get vaccinated. Dr. D, you wanted to chime in?
Yeah, I think the one correction I would say is that when we've done the math, it's actually going to be mid-July if we continue at this same pace. And I think Mayor Scott touched on this, right? Like, we are now shifting away from mass vaccination sites. We know mass vaccination sites are fast, but they're not necessarily always fair. So with our mobile and pop-up, we are really working to bring the vaccine directly to individuals and meet them where they are. And that means maybe 100 or so vaccines done at an event, not a couple thousand, right? So we know that we're shifting how we're approaching this, and that means there's going to be a shift in the volume. But we're fully prepared for that. We knew that was coming, and that's why we're shifting to more of the mobile and pop-up vaccination work.
Kate, Maxine, Kate, go ahead.
Okay. This is off topic, but it's for the same outlet. A colleague would like to get your reaction on Mr. Mosby's proposal for grant money for rental assistance.
So I haven't seen it yet, so we'll get back to you later today.
Okay. All right. Well, that doesn't count as a question. They said I can only have two. So let me just ask you back to the COVID. Do you just to not to put words in your mouth, but the pace, if it's 4,500 or so a week that you've been doing, is that pace going to increase weekly going forward, or is that what you're? I understand you can only do a few hundred at a time because I've been to so many of these mobile clinics, but are you going to ramp those up, and how many more each week do you think? How many more vaccinations a week do you think you'll be able to do going forward?
Yeah, so I mean, I think it's a multiple, party effort, right? So we work alongside clinical partners. We're also working with the Mayor's Office of Neighborhood, who is helping to canvass. And what we know about these events is that a lot of the success is based on that initial outreach prior to the event to draw people to those events. And so it's certainly possible that we'll see more. But again, it's a team effort, right? And so we're all working together to advertise those events, to get the information out there, working with our clinical partners to ensure that there is access to supply and those that can provide the vaccinations. Of course, I'd like to see the numbers increase, but I think we'll see in time as we advertise and provide education.
Thank you.
Maxine?
Mackenzie, not
Oh,
Maxine.
Mackenzie, I'm sorry.
That's okay. We get it all the
I have
time.
I have a sinus headache today, so I'm a little off.
Blondes, we look the same. Speaking of Gun Violence Awareness Day today, I wanted to ask you about a bill from 2017 when you were in City Council. You were opposed
The mandatory
to this
minimum
mandatory
bill?
minimums.
Yeah.
Now that you're mayor, do you look at that differently, and do you think there should be something locally done for mandatory minimums?
No, and I'll say this again, and let me be very clear. We already have mandatory minimums in Maryland, and anyone that knows about that bill, if you talk to the folks in Annapolis, mandatory minimums don't work. And I think what I want in particular your station to understand, I was here in 2011 when we had our lowest numbers of homicides. I was here in 2014. We had the second number. I don't remember Deputy Commissioner Barksdale or Commissioner Bill Fell saying we need a new mandatory minimum law. What we actually need is to make sure that there are swift consequences, and for sure consequences, to folks who are committing gun violence in the city. Maryland already has a mandatory minimum law on the books. What you saw in 2017 from the former mayor was what we call a ruse to try to divert everyone away from that. They were not focused on public safety, and they wanted to divert everyone's attention into this magical thing. They don't work. And what we have to do, and what we are going to be doing, as you and I talked about the other day, is actually doing the work, partnering with all of the agencies, federal. We had a big federal removal of a violent group yesterday, which is a swift and certain consequence when you're talking about federal gun crimes. We're going to be working with our state partners to bolster that as well, to make sure, again, that we're not having what we had last weekend, where someone was arrested in Baltimore County this year with a gun and ended up dead on the streets of Baltimore a month later. That's what we're going to be doing. It's not about mandatory minimums. It's about making sure the system that we have now works, and that every portion of that works. Not just the city. It's not just on BPD and the police commissioner. We have to make sure that everybody in the system works, and that's what we're going to be doing through our Criminal Justice Coordinating Council.
So would you say that right now that some of those partners at the federal level or at the state level aren't doing their jobs?
Well, they haven't. No, it's not
Would
about
that
them
be
not doing their jobs. It's about they haven't been at the table. Let me say again, we have a wonderful partnership with our federal partners. Clearly, as we are removing violent groups with them off the streets, that partnership is working. Now that the governor and I had our meeting, and that the state agencies are going to come back to the table for the Criminal Justice Coordinating Council, because, and something that the governor and I agree on, the folks that were here before me weren't focusing in on how to make that partnership better and having a deep focus on making sure that we're working together to remove violent groups from the street. Now everyone will be at a table and working together. I can't speak to why they weren't doing that before.
Would you say that the state's attorney's office isn't at the table right now, or they haven't been at the table to prosecute some of these for swift penalties?
Well, I think you saw just a few weeks ago, you saw again yesterday, this announcement was with the federal attorney and our local state's attorney. The relationship there is going to continue to work. We're going to continue to push. We'll hold everyone accountable at every level. Yes, sir.
Actually, just one question for Dr. Terraza. With the closure of the many mass sites, are you planning to add more mobile units to reach those individuals who cannot get to different places?
We are. So we'll continue, and we've posted our weekly schedule online now, but we're partnering with schools around vaccinating elementary students. So we'll strategically, we've selected schools across the city that will be up, 5 schools across the city that will be vaccinating there. Additionally, we'll plan to set up semi-permanent locations that will be in a particular neighborhood for a few weeks so individuals can come and get their first and second dose. But we've been doing mobile and pop-up vaccinations all along. This just allows us to divert additional resources to those efforts.
Okay, thank you.
Thank you, everybody.
Thank you.